We take a painkiller almost every week. But did you ever stop and ask, how does pain actually happen in the first place? And why does one painkiller work like magic for one person and do nothing for another? Today, we're not talking about one product. We're understanding the science itself. Because once you get it, you'll choose right every time. I'm Amro Abu Bakr, and you're watching Behind the Counter. Let's go. First, something simple. Pain is not just a feeling. Pain is a warning system created by the nervous system to alert the brain that something may be wrong. And the sensors that pick up that danger are called nociceptors, your body's alarm receptors. They respond to three main types of harmful stimuli. The first is mechanical, pressure, trauma, stretching, cutting, or tissue damage. Things like muscle strain, a joint injury, dental pressure, or trauma. The second is thermal, extreme heat or extreme cold, like burns or freezing injury. The third is chemical, irritating chemicals released during inflammation or tissue injury. Things like prostaglandins, bradykinin, histamine, cytokines, and substance P. So pain can start from physical damage, temperature damage, or inflammatory chemicals. Now watch what happens when tissue is injured. The damaged cells release danger signals. Those signals activate the immune system, and the body sends inflammatory cells to the injured area to start repair. During this process, it releases inflammatory mediators, prostaglandins, bradykinin, histamine, cytokines, and substance P. These mediators cause blood vessels to dilate. That's vasodilation. They also make the blood vessels more permeable or leaky. So fluid and immune cells move from the blood into the tissue. And that is how swelling happens. Injury, then mediators, then vessels dilate, then they leak, then fluid moves into the tissue, giving you swelling, redness, heat, and pain. But inflammatory mediators don't only cause swelling. They also activate and sensitize the nociceptors, meaning the pain receptors become more sensitive than normal. So now, a small movement, a light touch, or mild pressure can become painful. The alarm has been turned all the way up. Then, the pain signal travels through nerve fibers. A delta fibers carry fast, sharp, well-localized pain. That first sharp sting you feel right after an injury. C fibers carry slow, dull, burning, or aching pain. The deeper pain that continues afterward. The signal goes to the spinal cord, then to the brain. The brain interprets the signal, and that is the moment you actually feel pain. So the chain is a mechanical, thermal, or chemical trigger. Then nociceptor activation. Then the signal through the nerves to the spinal cord, to the brain's perception, and finally, the feeling of pain. Now, here's what most people don't know. Painkillers do not all work in the same place. Each class interrupts the pain pathway at a different level. Let me take you through the four. Paracetamol, also called acetaminophen, works mainly in the brain and spinal cord. It reduces central pain signaling and lowers how strongly the brain perceives pain. It also reduces fever by acting on the hypothalamus, the temperature control center in the brain. It's useful for headache, fever, mild to moderate pain, and body aches. But it has weak anti-inflammatory action compared with NSAIDs. NSAIDs include ibuprofen, diclofenac, naproxen, and celecoxib. They work mainly at the inflammation site. NSAIDs block COX enzymes, and COX enzymes help produce prostaglandins. And remember, prostaglandins increase pain, inflammation, swelling, and fever. So the mechanism is simple. NSAIDs block COX that reduces prostaglandins, which means less inflammation, less swelling, and less pain right where it started. They're useful for dental pain, arthritis, muscle injury, menstrual pain, and inflammatory pain. But they need caution in patients with stomach ulcers, kidney disease, heart disease, uncontrolled hypertension, blood thinners, or high bleeding risk. Sometimes the problem is not mainly inflammation. Sometimes the nerve itself is irritated, damaged, or overactive. This is called neuropathic pain. Patients describe it as burning, electric shock, tingling, numbness, pins and needles, or shooting pain. Medicines like pregabalin and gabapentin calm overactive nerves by reducing abnormal nerve firing. Other options include duloxetine, or amitriptyline, which strengthen the body's natural descending pain control pathways. These are useful for diabetic neuropathy, sciatica, shingles pain, and chronic nerve pain. Opioids include morphine, tramadol, codeine, oxycodone, and fentanyl. They work in the brain and spinal cord by activating opioid receptors, especially mu-opioid receptors. They reduce pain transmission and change how the brain perceives severe pain. They can be useful for severe acute pain, post-operative pain, cancer pain, and palliative care. But they require careful use because of risks like sedation, constipation, nausea, tolerance, dependence, respiratory depression, and misuse. And they are not the first choice for most chronic, non-cancer pain. So let's bring it together. Pain starts when mechanical, thermal, or chemical stimuli activate the nociceptors. Inflammation causes swelling because blood vessels dilate and become leaky. And pain happens because those nociceptors are activated, sensitized, and send signals up to the spinal cord and brain. And the painkillers each work differently. Paracetamol reduces central pain perception. NSAIDs reduce inflammation and prostaglandins. Neuropathic medicines calm overactive nerves, and opioids reduce severe pain signaling in the brain and spinal cord. So the right painkiller is not always the strongest one. It depends on the pain type, the mechanism, the patient's risk, and the treatment goal. Treat the mechanism, not just the symptom. So next time you reach for a painkiller, don't ask which is strongest. Ask which one fits my pain. And if your pain keeps coming back, see your pharmacist or doctor, because this is awareness, not a prescription. Tell me in the comments, which type of pain troubles you the most? Follow behind the counter to understand what's behind every medicine. Stay in grace, stay in health, stay in God's blessing,